Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize, once again, the benefit in benefit plan. Today's episode is brought to you by the FIA Group, empowering plans since 1999. Now here are your hosts, the FIA Group's own CEO, Adam Russo, and Senior Vice President and General Counsel, Ron Peck.
Greetings, hello, and welcome once again to Empowering Plans, the FIA Group's official podcast. With you today is myself, Ron Peck, Senior Vice President and General Counsel of the FIA Group. In addition, we have two guests in the studio today. We have attorney Andrew Silverio. Andrew, welcome.
Thank you.
And with us again, by popular demand, you did so well the last time, we thought we'd give you one more chance, is attorney John Jablon. John, welcome.
Thanks, Ron.
So for those of you who listened in on our last podcast, you might have seen or heard that the topic was very negative, a little pessimistic, and we were talking about providers, hospitals in particular, but also other forms of provider, the excessive prices, how, in essence, it feels as if we are being taken advantage of and the piggy bank is being drained way too quickly. And the things we could do to stand up to the big bad provider and tell them, you're going to get the fair price or nothing at all, and take a stand against providers. And one thing in hindsight I realized that we didn't do is talk about the successes and the cooperation that is taking place today between payers and providers, that it is not entirely negative and that there are a lot of positive accomplishments between payers and providers in our industry today. And with this episode, I really want to focus in on some of the efforts being made by the payers, these benefit plans, and providers together, because I think while it may not necessarily be the philosophy of every hospital system out there, every provider out there, I do believe many understand and appreciate that if we don't take action together as an industry, including the provider, to preserve group-based and employment-based health benefit plans, the risk, the threat of a single-payer system is real. And if providers think right now that Medicare is taking advantage of them because they're the biggest payer on the block, imagine the advantage they'll take when it comes to pricing if they're the only payer on the block, when they hold all the purse strings. So I think that a lot of providers of healthcare benefits out there today, they understand that it behooves them to ensure the financial viability and future of the benefit plans that exist today. And many steps are being taken to do that. And John, if you want to talk a little bit about your experience with the Free Market Medical Association, FMMA, and some of the things that you saw at their event.
Thanks, Ron. I had the pleasure of attending the first ever Free Market Medical Association conference out in Oklahoma. And I'll tell you, it was really a sight to see. There were tons of people there. I couldn't tell you the number of people, but it was a lot, and it was a very diverse population. There were medical providers, there were TPAs, there were health plans, there were even some networks and PBMs there, which might surprise you. But when you consider the fact that at the end of the day, we're all on the same team. It's not this mentality of payers versus providers that prevails everywhere. It's certainly true that that is the mentality that is taken in a lot of the industry, but there are lots of folks out there who realize that that doesn't have to be the case. It doesn't have to be a constant war of payers versus providers. We live in a capitalist society, after all. There are principles of steerage. There's a free market, of course, hence the name Free Market Medical Association. In every other market, there's lots of competition. Service providers are able to distinguish themselves based on price as well as quality, and those two things are arguably equally important, although I guess it depends on who you are. You might value one over the other. There are many people, a lot of patients specifically, who might value price over quality even. But in the current industry, it's very difficult to even get that data for consumers. So the Free Market Medical Association and these general principles of transparency are extremely important to getting our medical payment society, let's say, back on track, or back to where it it needs to be anyway. There's actually a really interesting phenomenon where a lot of providers are actually worried about going to jail or getting hefty fines if they disclose their prices. And that's actually something that I've heard a number of times over the years, where providers are saying, well, if we disclose our prices, we're going to get in a lot of trouble. Why? I don't know what that's based on. Every time I question it, it's hard to have a conversation because they kind of want to shut it down a lot of the times. A lot of these providers who are not used to transparency, to whom it's not really customary. But it's worth noting for any providers that are listening or anyone who's talking to providers, there's no prohibition on disclosing your prices. There's no law that says you can't. In fact, the normal terms of the law, including contract law, would tend to lean towards disclosing prices just for the sake of the free market. Now, it's also important as a final note here to say that if you have a PPO contract, it may actually prohibit you from disclosing prices, just because the mentality of the PPO is that the steerage depends on the fact that all the providers are kind of treated equally by the payers, and then disclosing prices kind of outs a little bit of the agenda that's going on. But that's neither here nor there. And like Ron said, last week we talked about kind of the failures of the networks, and I don't want to get into the weeds on that. But it's worth mentioning that as a provider, disclosing prices is certainly nothing to be worried about. It's something that helps the industry as a whole. And, for a perfect example of this, we would urge you to check out the Surgery Center of Oklahoma and Dr. Keith Smith. If you are not familiar with them, please Google them. It's called the Surgery Center of Oklahoma. On that website, you can see that Dr. Smith has posted prices for procedures. Prices are posted, dollar amounts. You can actually go to that website and see how much something costs. If that's not free market, I don't know what is.
It's interesting. I'm glad you bring that up, John, because, when you talk about what's quote-unquote illegal, my concern is that people in general, we're not just talking in our industry or providers, but people in general, I think often they confuse criminal law and contract law, right? Civil law. And what you don't understand is that while something may be illegal because there's an actual criminal law prohibiting it, a lot of things that people think are illegal, it's only because they've done it to themselves. They've agreed to something by contract to do or not do that, based on criminal law, they were free to do. And transparency and sharing your prices, those are things that I don't believe are inherently illegal. And you mentioned Dr. Smith. We have a number of friends who are involved in direct primary care, DPC for short, that are sharing their fees, charging a upfront subscription fee, things like that, where they're clearly sharing their fees, and it's not illegal. But at the same time, they haven't agreed by contract not to share that information either. And what I believe some of these facilities that you're talking to that say they're not allowed to share their prices with you because it's illegal, what has in fact kind of come downstream from their legal department down to that individual you're talking about is not that it's illegal, but that it would be breaching a contract. And so then the issue is not necessarily the state of the law, but rather the state of the contracts that they've agreed to, and why do those contracts exist that they're not allowed to share that information, and what can we do to get over that or around it to benefit everybody. Speaking of direct primary care and entities that are sharing their prices because they haven't agreed by contract not to, Dr. Gold here in Massachusetts, along with the FIA Group and a number of other friends in the industry, provider friends in the industry in Massachusetts. We just started our own chapter of the FMMA in Massachusetts. We're going to be meeting and talking about what we're doing regionally and also how we can assist nationally. So that's a great effort that's underway as well. These are some of the providers in the area and also nationally that understand how the entire market works instead of looking at it as a microcosm. And what's interesting when you talk about, and one of the things you mentioned, competition, it kind of made me laugh. Our industry, sort of an analogy, a comparison would be, it's as if McDonald's and Burger King were getting together and complaining about the customers and figuring out ways to mess with the customers. And it was sort of, it's us versus them. When in reality, any other business, Burger King and McDonald's, they're at each other's throats, they're competing with each other, and they value the customer. The customer is the client. The payer is the one you're supposed to pander to, not compete with. And our industry is the only one where the people who should be competing are conspiring, and the ones that they're supposed to be pandering to are the ones they're competing with, the payer. It's zany when you think about it that way. And I think that when you look internationally, providers in other countries where they don't have the same kind of opportunity to access all these private payers, they're looking at our nation and the way our healthcare is structured, and they're thinking, hey, look, if you don't want to treat those payers with respect and you don't want to work with them and collaborate and coordinate with them, we're going to come in and do that. You're going to leave that money on the table? You're not willing to take 200% Medicare? We'd love to get that kind of a payment. And Andrew, I don't know if you want to talk a little bit about some of the international providers that we're starting to see come into the United States and some of the efforts that are underway, and maybe also some of the cautionary tales as well.
Yeah, for sure. We certainly have something of a healthcare bubble, so to speak, in the U.S., and you see it, in a lot of surgical procedures, things like implants, joint replacements, the high dollar stuff. You see it even more so in pharmaceuticals. And I get it. From the pharma company perspective, it's expensive to develop new drugs. It's expensive to go through the R&D process and the clinical trial process. But beyond all of that, we have all these structures set up to sort of keep all that money within our borders. And we're seeing ways that the healthcare spending is leaking out, internationally. In regard to pharmaceuticals, you can get the same exact drug, chemically identical, it's got a different label on it, over in Canada or down in Mexico or across the pond in England. The same exact drug for, pennies on the dollar. But, if you can get the drug cheaper, 20 miles north, you live in Detroit, why isn't everybody doing that? Well, technically speaking, you can't. It's the FDA prohibits you from importing drugs that are manufactured for sale overseas. But there are ways that individuals can do it safely. Essentially, the FDA, this is a very well-documented policy. They have it posted on, FDA. It's probably fda.gov. I don't know off the top of my head. But they just don't enforce these laws against individuals who import prescription drugs for personal use. They have limitations on, how much you import. They say, it has to be for personal use, 30-day supply, 90-day supply. So basically, individuals can do it safely, and health plans more and more, we're finding ways for them to sort of step in and assist the individuals in doing that, if that means reimbursement after the fact. There are ways to do it safely. But again, the law on the books mandates that, you tread carefully and do things right with people who know what they're doing.
So that idea of selective enforcement, it's kind of funny if you think about it this way. It's almost as if there was something in FAQ on the government's website that indicated the speed limit on Interstate 95 is 55 miles per hour. However, we will not be stopping or ticketing anyone who is going beneath 65 miles per hour. We will not be enforcing the first 10 miles per hour over the speed limit. It's to the point that it's almost like that. And if I'm a provider within the United States, that should concern me, right? I feel strong that I'm protected by the laws which prohibit importation of foreign drugs. But at the same time, I have to realize, A, there's nothing stopping people from going outside the United States, seeking treatment outside the United States, and then coming home. B, there's this selective enforcement as far as bringing the supplies into the United States. And again, you constantly hear politicians, people running for office talking about, hey, why don't we open the borders? Why don't we allow even more competition? Those things, the ability to go outside the United States, the ability to take advantage of selective enforcement, and the fact that there's a lot of talk about increased competition, you would think that those, as well as the threat of a single-payer system, should really be scaring the entities within the United States that provide health care to take action, to identify ways to create better relationships with the payer and secure those funds and those customers, because patients truly are customers. before those gates open even more. And unfortunately, I don't think we're seeing it as much as we would think we would, but at the same time, we're not seeing it at all. And as people within the industry, as payers and representatives of payers of these benefit plans, it behooves us to identify those providers that are looking to cooperate with us. It's important to find those providers that are looking to collaborate with us and encourage them and reward them for their efforts and figure out a way that works. So for myself, Andrew, John, the FIA Group, and the many listeners we have, thank you so much for joining us. Thank you so much for assisting us in empowering plans, and we look forward to the next podcast and talking to you then. Thank you so much. Enjoy your summer.